Hello, and welcome to a Health Podyssey. I'm your host, Rob Lott. As the U.S. population continues to age, millions of Americans need help navigating a wide array of health challenges, chronic conditions, disability, and in some cases, cognitive decline. In just as dramatic numbers, that assistance is being provided to older adults by family caregivers. That is to say, the partners, children, siblings, and others who we as a society rely on every day to meet the needs of an aging generation of baby boomers. This is not new, but in recent years, this landscape has undergone a series of profound changes, coinciding with, and in many cases, shaped by efforts to promote population-based payment, new approaches to delivering care, and a laser focus on building age-friendly health systems. How have these changes affected the composition and experience of family caregivers in America? That is the subject of today's Health Podyssey. I'm here with the talented Dr. Jennifer Wolff, a professor of health policy and management at the Johns Hopkins Bloomberg School of Public Health. With her co-authors, Dr. Wolff published a paper in the March 2025 issue of Health Affairs. Its title is also its main finding. The number of family caregivers helping older U.S. adults increased from 18 million to 24 million from 2011 to 2022. And I'm pretty eager to ask Dr. Wolff all about it. Welcome to the program.
Thanks. I'm delighted to be here today.
So I think most people have an idea of what we're talking about when we use the term family caregivers, and indeed many people have played that role or know someone who has. But in the context of your research specifically, what are you talking about when you talk about family caregivers?
Well, thanks for the great question. You are right that the concept of family caregiving is seemingly straightforward, but it is deceptively difficult to rigorously measure. Typically, we think about family caregiving as help being provided for health and functioning reasons, in which the primary motivation is a personal relationship between the person providing care and the person who needs care, rather than financial gain. We also typically think about family very broadly in this context. Family is often a spouse, an adult child, or a parent, but it can also be a grandparent, a grandchild, a sibling, step relatives, or close friends who reflect families of choice. The types of caregiving activities are wide-ranging. Care can include help with daily self-care activities like dressing, eating, bathing, or getting around inside. Care can include household activities like preparing meals or handling bills and banking, driving places like medical appointments, or healthcare navigation that involves managing medical treatments, coordinating care with medical providers, or working around issues around health insurance access and medical treatments. Another complication is that caregiving can occur for a short period of time, for example, to manage the transition from hospital to home for an acute emergency, or it can extend over many years, for example, in the context of chronic progressive conditions like dementia.
Okay, so before we dig into your research, I hope you'll forgive sort of an existential question, which is that, I think in many people's eyes, this concept is just sort of part of what it means to be a human being in the world with other human beings, right? When your loved one needs care, you do what you can, maybe even more than what you can to make sure they get that care. So as the devil's advocate here, if this is just sort of part of life, what's the sort of policy angle? Why are we measuring this, or why is it important really to measure this?
Yeah, that's a great, very important issue. And to your point, there's a famous quote by the late former First Lady Rosalind Carter, who was a tremendous advocate, who said, "There are only 4 types of people in the world: those who've been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers." With that said, caregiving matters because it has profound individual and societal consequences, and the effects are not evenly distributed. For people with disability or serious illness, the availability and adequacy of family care is a critical factor in determining the ability to remain living in the community or in the setting of one's choice. It affects quality of life. It also affects care quality. For those who provide care, caregiving responsibilities have important consequences for physical, emotional, and financial well-being that can be both positive and negative. Caregiving importantly affects decisions about remaining in the workplace. It can affect productivity while at work, so it has effects for employers. Family caregiving also has notable impacts on society, including the health and care delivery systems. The availability and adequacy of help provided by family caregivers can affect the trajectory of outcomes, for example, allowing a patient to be discharged from the hospital back home as opposed to a post-acute care facility. We also know that the effects of caregiving are disproportionate for those who have fewer economic resources, who are less able to access paid help, and those who help people who have more complex health needs. To a large degree, when we're talking about family caregiving, we're talking about a workforce. It's a workforce whose members have typically fallen into their role without any preparation or training and without a formal scope of practice, and who deliver care in highly varied home and community settings, most of which were never equipped or intended as a care delivery setting. And I would say that the success of medical and technological advances that are leading people to live much longer lives make it increasingly important and necessary to understand and improve the experiences and capacity of this family caregiving workforce.
It's really interesting you use the term workforce. In my mind, I think about people who are employed, people who get paid salaries. It's their job. And nevertheless, the population we're talking about here is doing all that work, but without the payment, without the full-time employment. So that's an interesting way to look at it. And I imagine that might shine some light on my next question, which is basically, how do you assess that when you don't have time cards and pay stubs and that kind of thing? How did you measure family caregivers?
Yeah. So you're right. There is not a systematic approach to identifying family caregivers in care delivery settings, or, for example, through the census and sort of, thinking about collecting information at that level. So in terms of how we conducted our study, most of what we know about family caregiving comes from surveys. And for our study, we draw on two linked national surveys, the National Health and Aging Trends Study, which we call NHATS, and the National Study of Caregiving, or NSOC, both of which are funded by the National Institute on Aging. The NHATS interviews about 8,000 older adults each year and has been conducted annually since 2011. And this study collects information about how older adults perform daily activities, including whether they have difficulty, use a device, or receive help. The helpers of older adults who receive self-care, mobility, or household help for health and function reasons are then eligible for the National Study of Caregiving, which collects information about the types of care provided, the supports used, work and work impacts due to caregiving, as well as positive and negative aspects of providing care. I will note that the National Study of Caregiving interviews up to 5 family caregivers for each older adult who receives care. And a key issue is that these two linked surveys allow an understanding of the caregiving experiences for a very well-defined cohort of older adults, that includes, for example, where the older adult lives and whether they have issues like dementia that are not well diagnosed. So this is really important. It's the only national survey platform with this linked design. And these two data sets surveys have been collected consistently, which allows an understanding of trends and how the experiences of care is changing for caregivers based on shifts in the underlying population of individuals receiving care. And these linked surveys are just have been very, very important for providing insight about the experiences of family caregivers to older adults.
That's great. You said that the survey started in 2011. Was it developed to address this problem that we don't really know as much about the family caregiver population? Is that what it was trying to address when it started in 2011?
Yeah, so the National Health and Aging Trend Study, or NHATS, was primarily developed to understand trends and trajectories in disability and really understanding changes in the health and function of older adults. But the National Study of Caregiving was specifically developed to try to understand the impacts of disability for older adults, family caregivers.
Let's talk about results then. Dr. Wolff, what did you find? And maybe give us some of your top line findings.
Sure. So we found that a larger number of family caregivers were assisting a population of older adults who were incrementally younger, better educated, and less likely to have dementia in 2022 compared to 2011. We found that family caregivers continue to be predominantly spouses and adult children, although they were somewhat less likely to be adult children in 2022 than 2011. We also observed notable stability in the size of older adults helping networks, with about 2 caregivers for every older adult receiving care, as well as in the experiences of family caregivers with respect to competing employment and childcare responsibilities, the numbers of care hours that were provided, as well as the emotional, physical, and financial difficulties associated with providing care, despite reductions in use of supported services such as respite care and support groups.
Wow, a lot of great information there, a lot to dig into, which we'll do after a break. And we're back. I'm here with Dr. Jennifer Wolff, reporting on her paper about family caregivers. Dr. Wolff, one area that seemed particularly notable was care for patients with dementia. If I read the paper properly, there were fewer caregivers providing care for fewer adults with dementia. That feels like good news. However, for those caregivers who are assisting people with dementia, they're spending a lot more time in doing that work. How do you interpret those seemingly divergent trends?
Yeah, so we did find that the share of family caregivers in older adults affected by dementia declined. The number of older adults receiving family caregiving who did not have dementia increased from 6.7 to 10 million, while the number of older adults with dementia decreased slightly from 2.7 million to 2.6 million. And the estimated number of family caregivers assisting an older adult without dementia increased from 12.2 million to 18.9 million, while the number of family caregivers assisting an older adult with dementia decreased from 6 to 5.2 million. And this is a good thing. However, we observed 3 trends that are noteworthy for caregivers to older adults with dementia. We found they were less likely to be employed, more likely to live with the older adult with dementia, and we found striking increases in the average hours of care provided by caregivers to older adults with dementia. For those caring for an older adult with dementia, the share working fell from 43% in 2011 to 35% in 2022, and the hours per week increased from about 21 to 31 hours. So it's notable that these shifts were not evident among caregivers to older adults without dementia, for whom the experiences were more stable. And it's also reassuring that these trends were not accompanied by corresponding increases in caregiving-related difficulty or contractions in the size of the helping networks, but nevertheless, results do suggest that for the smaller share of family caregivers assisting older adults with dementia, their concerns about increasing demands can be warranted. And I think that this really reinforces the importance of these kinds of national data to allow tailored surveillance and potentially, greater support for subpopulations who are differentially impacted.
I think there's a common narrative about family caregiving that not only is this incredibly hard work at the individual level, emotionally, physically, but that we're also really struggling at the societal level, where things have seem at least to have gone from bad to worse. And as time passes, it's only heading in that direction, as if it really is bad and getting worse. But these results seem to paint a different picture, one of stability, essentially. Is that stability genuine in your eyes? And is this reason to be optimistic?
Yeah, I do think there's a reason for optimism. The advocacy community has done an outstanding job of raising awareness about the potential implications of greater rates of childlessness, smaller and more geographically dispersed families, shifts in increasing labor force participation on family caregiving availability, as well as the impacts of greater home-based care and how that may increase demands on family caregivers. But it's also true that older adults are better educated and healthier than ever before. Also, there's a growing array of strategies that can be used to compensate for declines in function. People can use assisted devices. They can modify their home environment. They can move to a new residential setting or perform daily activities differently or less often. For example, using technologies like electronic banking, automated prescription refills, and rideshare programs. The shift towards universal design elements in residential settings like elevators, ramps, and wide doors make it a lot easier to navigate the world in a wheelchair. I think all of these are reasons for optimism in terms of the benefit of innovation in reducing the impacts of functional impairment. However, it's also true that the baby boom generation has not yet entirely reached advanced ages at which frailty risk is greatest. Next year, the leading edge of the baby boomer population begins to reach age 80, so the demands placed on the care delivery system and on families is likely to increase in the years to come.
Okay, so against that backdrop, let's talk a little bit about policy mechanisms at play. And I think you just sort of hinted at that with some of the changes that we've seen. My sense is that the public sector doesn't do a lot to help family caregivers navigate the challenges they face, but it's not nothing. So let's say I'm a recently retired 66-year-old person taking care of my spouse with cancer. What are some of the ways that I'm going to experience or feel the impact or hopefully the support of the government investment in this area, whether it's the local, state, or federal level?
Yeah, it's true that the available resources to support family caregivers is disproportionately small relative to their contributions. Nevertheless, there are many available programs made that are available through advocacy groups like the American Cancer Society, the Alzheimer's Association, Family Caregiver Alliance. The National Family Caregiver Support Program is a flagship program administered by the Administration on Community Living that's specifically devoted to addressing the needs of family caregivers through information and resources like respite care and counseling, through aging and disability resource centers operated by states and territories. Paid family leave has been enacted by selected states and employers and offers time-limited partial income replacement for workers with caregiving responsibilities. Medicaid home and community-based supports indirectly benefit caregivers through expanded service offerings to individuals who are living with disabilities and are low income. And these waivers can be used for caregiver support, but they are really a trivial proportion of spending by Medicaid. Increasingly, Medicare has offered some benefits to family caregivers, for example, through the Medicare hospice benefit. Also, the newly introduced voluntary guiding and improvement dementia experience model or guide provides respite support to family caregivers of older adults with dementia. And the Department of Veterans Affairs has a very comprehensive caregiver support program. And these are all really exemplary nationwide programs that support family caregivers, but they tend to be limited to people who meet specific eligibility criteria.
Got it. Okay. So if that's sort of the way things are, can you say a little more about the way things could be? What can we envision in terms of progress in the years ahead? Are there any specific steps? Perhaps if you could kind of wave a policy wand, what would you do to make life better for older Americans and their caregivers?
So I will say that the 2018 Recognize, Assist, Include, Support, and Engage or Raise Family Caregivers Act and the 2022 National Strategy to Support Family Caregivers are really important steps towards having a cohesive framework in support of the care economy. This national strategy articulates hundreds of recommendations and actions that can be pursued by federal and non-federal partners and has really been an important bridge for coalescing organizations and coordinating policy progress. Last year in 2024, Medicare for the first time introduced into its fee schedule a billing code that enables reimbursement for training and education of family caregivers. The national strategy calls for enhanced infrastructure for surveillance and monitoring of caregivers. And I think that's sort of reinforced by our work in terms of amplifying the importance of really understanding the success of efforts and impacts and monitoring impacts for specific subgroups who may be more vulnerable. I think there's a lot of opportunity now in care delivery because of the greater appreciation of the important role of social determinants of health. And certainly for people who are living with serious illness and complex health needs, family caregivers have a huge role in ensuring access and effectiveness of care. So I think that's, to the extent that we can really better identify, engage, and support family caregivers at the point of care across a variety of care delivery settings, I think that really would have the opportunity to be a game changer.
Great. A glimmer of hope looking forward here. Before we wrap, I did want to take a step back with you. You've been in this field for nearly 30 years, I think. And I'm wondering if you could say a little bit about what's changed since you started your career.
Well, I would say the pace of change is just really striking. There's so much innovation in care delivery, in the structure of Medicare and Medicaid. There's so much of an increase in the volume and the array of information that's available to care delivery organizations and researchers at a range of levels, the person level, the care delivery level, pulling in information about the local environment and place-based factors. There are more tools available than ever before to assemble this information and act on it. And I think the greater appreciation of implementation science that incorporates workflows and electronic tools and resources to advance learning health systems that extend outside the walls of care delivery institutions is really exciting and holds promise for improving value outcomes and care quality and the care experiences of people receiving care, including their family caregivers.
Awesome. Well, thank you so much for sharing your wisdom from that experience and that shift over time. And thank you for being here today. We really appreciate you taking the time to chat with us.
Oh, this was fun. Thanks for having me.
And to our listeners, thanks for tuning in. If you enjoyed it, please tell a friend and tune in next week for another episode of Health Podyssey.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about a Health Podyssey.